So our 2 minutes is up. I hope you had an opportunity to stretch your legs. So we're going to move forward on our agenda. The next thing that we want to do is spend some time talking about the Region 9 Healthcare Hazard Vulnerability Assessment, which all of us have participated with to some extent for our facilities. And now we're undergoing a healthcare coalition effort to look at what are the healthcare vulnerabilities. And so Maureen Murphy is going to walk us through the process and help us better understand that.
Thanks, Ed. All right, so my name is Maureen Murphy. I'm new here. I started in September. If you're at the September meeting, you probably saw me with the baby. I'm the baby's mom. I'm the Eastern Washington Healthcare Response Planning Coordinator. So I work with Region 9 on planning, and then I also support Region 7 and 8 on their planning efforts as well. So my first project has been to complete a hazard vulnerability assessment for the Region 9 healthcare facilities that ASPR has put out, the healthcare preparedness and response capabilities. And the definition up here, just so we're all on the same page, is what ASPR defines as a hazard vulnerability assessment. And ASPR is the federal is an agency, a federal agency that oversees the work that we do. So it defines a systematic approach to identifying hazards or risks that are most likely to have an impact on the demand for healthcare services or the healthcare delivery system's ability to provide those services. So essentially, it looks at the probability of the hazard as measured in likelihood or occurrence, plus the impact, in this case, the impact on healthcare, and that equals the risk that we're looking at. A lot of facilities and organizations and jurisdictions do this sort of work at the facility level, and within that, they'll look at human impact, property impact, and business impact. But because we're taking this model and applying it to the regional level, we really just boiling it down to one impact, which is the impact on healthcare services. And then this work specifically is kind of pulling and referencing the hazard vulnerability assessments that the facilities and organizations in Region 9 do, but it does not replace the work that those organizations do. So this kind of is another layer that organizations can reference when they are doing their facility-specific HVA, but it's not replacing that note. And then participation has been voluntary in this process. So it's by no means completely scientific, but again, I think it's a really good data point that we can reference moving forward over the next 5 years, looking at hazards regionally. And then as the outcome, like I said, will be a regional hazard vulnerability assessment that that can be referenced when creating site-specific ones. And it'll also help inform our training and exercises over the next 5 years to focus on priority hazards and find ways to address those gaps that we might have. So the process that we laid out is, in a nutshell, it's a Delphi method, which is an iterative process through surveying. So we do 2 sets of surveys, and then we're kind of capping off with a webinar. But essentially, we survey subject matter experts on hazards, and then we aggregate all that information, and then we send out a second survey to review that and provide additional feedback. And it's just kind of a decision-making tool to come up with the prioritized list that we can push out and include in this assessment. So again, the 2 rounds of surveys, and then we're going to do a webinar in December. We did 1 round, which I will talk about today. Our second round is coming up next week, and then a webinar in December to kind of go over all these results. So really quickly, the first round of the surveys, we really wanted to focus on our healthcare partners because this is the Regional Healthcare Coalition Survey. We use the EI contributor list, but we just pulled the healthcare partners specifically in order to make sure that it was really focused on what they see as risks and hazards. We sent it to 120 participants representing 50 facilities organizations. And again, we collected responses from October 23rd to November 3rd. So just a quick overview. This was the demographics that we got back from the survey. So 26 individual responses, and the survey was about 25 minutes, I'm hoping, for the people who might have taken it. So it's about 25 minutes. So it was a fairly big ask in my perspective. Usually we like to keep surveys pretty minimal, but definitely appreciate the input that people provided. So I feel that 26 individual responses was pretty good, considering that represents 22 different agencies. And then you can see we asked the median years of experience. So a lot of very seasoned, as we heard the buzzword, seasoned employees, people in this field and the work that they do. Very heavy in Spokane, but we did get at least one response from a lot of surrounding communities. So again, by no means completely holistic, but I think a fairly good segment. And then we also asked what sector you work. So you can see hospital has a very high representation, but because of the focus of this being the Healthcare Coalition, I think that that's, we're okay with that, that's the focus of this first round. So really quickly, we asked for 3 different metrics in this round of surveys. So again, the probability plus the impact equals risk. So the tool that we are using breaks out probability into 2 different metrics, occurrence and response, and you can kind of see how they're rated up there. And then we also asked about the impact to regional healthcare services. So again, not at the facility level, but what would be the anticipated impact level at the regional level. So we asked we looked at more or less a all hazards approach. A lot of this, especially for jurisdictions, we'll just look at natural hazards, but we looked at naturally occurring incidents, human-related incidents, hazardous materials, and then technologic and utility incidents. So again, we sent out the responses, and then we're aggregating all those responses and then utilizing the tool, which if you're familiar with, there's a lot of tools out there. A lot of them are based on the Kaiser Permanente tool, and we're kind of using a version of that brings in some community aspects. So I took all that data and I'm going to be inputting it into the tool for analysis. Okay, I was debating whether or not to do this, but I think we're okay on time. So how do I pull it up? Alt tab. Okay. So this is either going to be a really good idea or a really awful idea. Trying to get, I don't even see, oh, there, full screen mode. Okay. So this is not been put, this is data that's not been put through the tool. This is just kind of a visual representation at this point. I'm a really visual learner, so I was really curious to see what it looks like when we throw it up on a scatter plot. So to sort of explain this, we have the healthcare impact charted against the regional response level, and then the size of the bubble corresponds to the likelihood of the incident. So bigger bubble means that it happens more frequently. And then you can see it goes low to high on the bottom and then low to high on the top. So the hazards up in, let's see here, there we go. So the hazards that are grouping up in here are what we've been seeing as higher response probability, as well as higher impact level. And so you can see, just as an example, wildfire is the healthcare participants indicated that there would be a need for high regional response, but more of a moderate healthcare impact, whereas you can see influenza up here, pandemic influenza, is a little bit high on both of those aspects. And I guess I can look at mine while you guys look at yours. So this is really just, I put draft up here because there's no weighting in it from the tool, and it doesn't incorporate the second round of surveys that we're going to be doing, but it kind of gives an idea of where things were charting as I was digging through the data and looking at the different scores. Okay. So then really the process moving forward is that we're going to be doing the second round of surveys, and this second round is being expanded to include our public health and emergency management partners. So we're taking the data that was ranked by healthcare partners and then asking the healthcare partners to assess for mitigation, preparedness, response, and recovery, but we're also asking our additional emergency managers and public health to essentially respond to it and give feedback on the same hazards that were done from healthcare. So they will not be rating them, but they'll be responding to the ratings that healthcare did. So we're kind of starting with our core group and then expanding outwards as far as engagement. And so this will go out on Monday, and we're also going to have a few thought questions that regarding impacts to vulnerable populations. It's an aspect that's part of the capability requirement to address individuals that have additional needs. So we're just going to kind of throw some questions out there, get some initial feedback that can kind of help us dig into this discussion a bit more, because it's not something that we fully explored, and we're not necessarily using this tool to come to any conclusions, but really just starting that conversation around vulnerable populations. And then again, we're ending with a webinar in December to provide overview of the findings and outcomes and have a discussion that way. We do have it scheduled on our end. We'll be sending out some more information with the survey next Monday. And then I think I'll be coming back in January potentially to discuss this, but we'll also send out the assessment and share it widely so that everyone can kind of look at it and reference it as we move forward and as you guys work on your own facility HVAs. So that is really the gist of it. Again, thanks to the participants. We did sort of switch gears midstream and had a meeting that we were going to do today that we switched to a survey instead. We just want to be really intentional with everyone's time, and then also we did want to add in the second component with those phases of emergency management, and just felt the survey would be a little bit better. So we're still asking for participation. Instead of a 3-hour meeting, we're going to be doing another 25-minute survey. So hopefully it saves you guys time as well. And I know that there was a couple of people that showed up, so I apologize if that information did not filter out this morning. But do look for that survey coming out on Monday. And you know, the more information and the more data that we can get just makes it a little bit better. So any questions?